Hi, welcome to Leadership at the Forefront of COVID. I'm Dr. Ann Pendo, Senior Medical Director in the Office of Patient Experience at Intermountain Healthcare. And today, my guest is Dr. Jason Spaulding, the Associate Medical Director of Post-Acute Care. Jason has worked as a hospitalist at Intermountain Healthcare prior to this role.
Thank you, Ann.
So tell us a little bit about your job before COVID, and when was the moment you knew your job would be different?
My job before COVID was as the first physician and then the medical director for our post-acute care team. We're a relatively small team, so a number of our Intermountain colleagues probably don't even know that we exist. But our model is to have full-time nurse practitioners in a variety of nursing facilities throughout the state, providing primary care in those facilities for our Intermountain discharges with physician backup. It became real to me watching the initial outbreak in Washington State and seeing that this was affecting a long-term care facility in Kirkland, Washington. With that, I realized that our roles were going to change and that our workflow was certainly going to change in different post-acute care communities. Early on, there were several allies in Intermountain Healthcare that also realized that, and our case management department, led by Maria Hill, were very vocal about the likely need for Intermountain to have a place for our patients to go who are COVID positive.
And these are patients who've been in the hospital and aren't able to go home, need to be in some kind of care center.
Indeed. So typically what would happen is if a patient's been hospitalized and then needs additional rehab services, they go to a skilled nursing facility or a skilled rehab facility. The difficulty in this case is if you have a patient who's COVID positive, to put them back in a population where other patients are not COVID positive is a recipe for disaster. And so we, after having seen the outbreak in Washington State, but then really some of the tragic occurrences that have happened in other states in the United States, where COVID positive patients and COVID positive staff members spread the illness throughout those settings, we realized really quickly that we were going to need COVID-only skilled nursing facilities. And while that started out as an Intermountain effort, that was actually quickly adopted by the state of Utah, who wisely used some Medicaid funding to be able to put in place a couple of different COVID-only skilled nursing facilities. It's been interesting. If you look at our population, less than 3% of Americans live in any sort of long-term post-acute care, including assisted living. But that patient population has made up 40% of the deaths from COVID in the United States.
Wow. So it sounds like you went from organizing around patient care to really now thinking about processes and how to implement new ways of caring for patients. And that was a new skill for you?
Indeed. Going into City Creek, which was the initial facility in the state of Utah, I had already been identified as one of the two people who would be an attending there. And one of our nurse practitioners, Holly Jones, stepped to the plate as well to care for Intermountain discharges there. Coming into a building that has never taken care of pandemic patients before is something that we've all experienced. Our hospital colleagues have dealt with this. Our infection preventionalists have dealt with this. We've dealt with this in all of our offices. We've dealt with this in all of our clinics. What's interesting about this is an effort between a group, Ensign, who owns multiple skilled nursing facilities, the state of Utah, as well as multiple health systems. So we got some help from the University of Utah, but our Intermountain infection preventionalists were actually instrumental in making sure that we had a safe workspace for the professionals working to care for these COVID patients after they came out of the hospital.
So really a broad scope, and also I'm thinking of big sense of urgency to get this up and running.
Yeah.
So tell us how long it took from when you first realized the need, bringing everyone together till you were able to get this up and running.
Pretty remarkably, it was weeks, not months. Wow. Beginning of March, once we realized that we were all going to have COVID in all of our states, and seeing some of the news reports coming out of not just Washington, but what was starting to happen in New York was when I started entering dialogue with Maria Hill. The state took over pretty soon after, and remarkably, they were able to put together contracts with Ensign within a number of days. Maybe the most remarkable thing that I saw was the group working in the facility managed to discharge 64 patients in 48 hours to a variety of other facilities, finding safe discharges for all the people there, and then turned around working tirelessly to set up to the best of their ability safe processes in a building that had never dealt with this sort of patient population before.
Wow. How did you take care of yourself during this time? What did you do to stay energized and refreshed and, with the ability to keep moving forward?
Part of the way that I've been able to deal with COVID-19 as well or as poorly, depending on whose perspective you want to take, as I have, has been by contributing. And this was something that I could throw myself in really with both feet. I'm lucky that I had the support of the people who I report to in doing so. They realized early on that Intermountain did need a strategy around this. And although it was a little bit of a different strategy from my normal workflow, they were very encouraging of our being involved in this. It allowed me to stretch myself in a variety of ways that I haven't before. I haven't done infection prevention. I haven't done donning and doffing for an entire building of people who may never have donned full PPE before. But these were things that I got involved in very quickly. Also realizing that our discharges to the facility were not just going to be from Intermountain. This is going to be from every hospital in the state of Utah. So that means multiple different hospital systems. On top of which, one of the other use functions of having a COVID-only skilled nursing facility is if you have an outbreak at another care center, be that post-acute or long-term care, or even a group home or an assisted living, we've been able to provide through City Creek and now expanding into other facilities, a place where we could have patients pulled from the place in which they're living and brought into City Creek to help keep outbreaks from becoming large outbreaks.
Wow. In the last few minutes that we have, share with us the one or two leadership lessons or the things that you've learned about yourself as a leader or yourself personally.
Well, first I would say be humble. Don't make assumptions about those you're going to be working with, particularly for those of us who might not work outside of Intermountain with others. I've had the opportunity to do so now for 3 years. All of our skilled nursing facility partners, they're partners. There's no contractual obligation. These are relationships that are built so we can take the best care of our patients. Realizing very early on that they did not have the skills and particularly the equipment to really take care of these patients. So humility about that, and also really setting aside assumptions about people who have very different jobs. I've gotten to meet a number of people who work for the state of Utah in governmental positions who I have been inordinately impressed with. It has been so refreshing to watch a group of us from the Department of Public Health to public safety officers, to those who are in charge of skilled nursing facilities through the state Medicaid, the University of Utah, Steward, Mountain Star, Intermountain Healthcare, come together with a unified cause around keeping our elders safe in this realm. It's been maybe one of the only joyful portions of going through what we've had to go through.
Oh, thanks so much for sharing that. And thanks for all the work that you've done taking care of our elderly patients. That's so important.
Thank you.
We'll look forward to talking again soon. Thanks, everyone, for joining today. Leadership at the Forefront of COVID, and we'll talk with you next week. Thanks.